Hi guys, welcome to the Vet Surgery TV channel. In this video, we're going to go through a complete step-by-step castration surgery of a male cat and learn everything together. At the same time, we'll review key points from the book Small Animal Surgery by Fossum, so that our approach is both scientific and practical, based on reliable and standard veterinary references. Let's get started. As you can see, these little ones have been removed from the scrotal sac after surgery. In cats, it's better not to shave the scrotal hair, but to pluck it by hand instead. Because shaving can cause tiny skin scratches that may lead to infection, while plucking keeps the skin intact and reduces the risk of contamination. In kittens less than 16 to 20 weeks of age, plucking scrotal hair may be difficult. Use clippers to gently remove scrotal hair in these animals. The scrotal area is prepared for surgery using diluted povidone iodine solution, followed by a quick wipe with 70% alcohol. This combination provides effective antisepsis while minimizing skin irritation. Mobilize one structure within the reproductive pouch by applying gentle pressure with the thumb and index finger at its base. Make a 0.51 centimeter incision over each structure at the lower end of the pouch, directed from cranial to caudal. Incise the parietal tunic carefully and gently bring the structure outward. Use your finger to separate the soft connective attachment between the lower part and the surrounding tunic. For an overhand or figure 8 knot, the cord is tied on itself using a curved mosquito hemostat. It is preferable to separate the parietal tunic from the surrounding tissue before securing the knot. Place the hemostat on top of the cord. Wrap the distal end of the cord over the hemostat once. Direct the wrapped hemostat ventral to the cord while holding the structure in the opposite hand. Open the tips of the hemostat and grasp the distal end of the cord. Transect the cord near the structure and pass the severed end through the loops around the hemostat. After surgery, an Elizabethan collar should be used for 2 weeks.